Great. This session, I'm really excited to welcome Ian Imrie from Tantus Health. Ian's going to be talking about CBD. Now, I'm very intrigued. I don't know a lot about it, so I'm going to hand straight over to Ian and let him tell us all about it. Hi, Ian. Thanks for coming.
Thanks, Erin. Thanks for having me and giving me this opportunity to review what's going on with CBD. What does it mean to me and my health, and everyone that is interested in what it can do for your all around wellness. So, just a little bit of a backstory. Our existence came with one of our family members who was experiencing cancer for the second stage in their life, and they found that cannabis was going to be one of their best tools in their toolbox to help with their wellness. And the problem that it came across at that point was, where do we go to get cannabis, medical cannabis? Where do we go to work with people to get that type of support? Did not exist. So once Canada released the legalization of medical cannabis, that hole in the market was still there. So some business partners and I decided that we need to create a community where people that are looking for all wellness, natural wellness, medical cannabis, we need to give them a community that they can come to. And that's where Tantus Health Co. was created and established. And what we do is we provide the support for everyone that, like yourself, I need to know a little bit more about CBD. What does it do? So we are going to be working with people to make sure that they have the education, the support, the consultation through general practitioners, nurse practitioners. We want to be able to give them that support so that they know they're not alone going through this process. So what I wanted to do here today was just do a quick introduction to what's going on in the world of cannabis and what can it do for you. Well, there's lots of medical conditions that are being currently treated with medical cannabis. A lot of doctors are realizing that there are other options out there other than going around and prescribing the pharmaceuticals that are out there. And what they found in the market is that over prescribing specific ailments becomes a little bit of a problem when it comes codependency on those pharmaceuticals. So when you're looking at a natural medicine being able to treat medical conditions, medical cannabis really stepped up in the market in the last 3 years. And a lot of education has really rose to the top on how we can deal with this holistically, because at the end of the day, this is a plant we're talking about, an extraction from a plant that are helping people with their medical conditions. So what kind of medical conditions are being treated? There's the regular bandits right there. Sleep deprivation is a big one. People are relying heavily on CBD to help them sleep. Arthritis, depression, insomnia, inflammation, chronic pain, arthritis, ADHD, all of them are being treated through medical cannabis. And a lot of the phone calls that we get start with that. I'm getting a little bit older. I'm noticing my knees are not the same as they used to be. Does this help that? And we are not here to say that medical cannabis will fix you. We're here to let you know that there is a treatment available that will be heavily derived from the medical cannabis. And that's why we want to make sure that when we are setting up appointments for our patients, that they are supported through the medical system, and having a coach, practitioner, or nurse practitioner make sure that they have what they need for their particular ailment. And that's exactly what the doctors are saying. Well, why medical cannabis? Why is that being used? And a lot of the doctors that I've been talking to and working with, some of the quotes that you're seeing here, it is the safest tool in my medical toolbox. Dr. Kogan just released a book called Medical Cannabis. It's on Amazon, just released it in October. Fantastic book that will actually review what medical cannabis is doing for him and his patients in New York. He found that medical cannabis in the palliative space, where people are coming to end of life, medical cannabis is actually helping that end of life much more comfortable than relying on heavy medical drugs that keep them catatonic, put them into comas, and just not exiting life that they would want. And he is preaching this to the doctors, that letting them know that there is other alternatives that are offering this type of end-of-life practice. And it's very interesting to hear him speak on what importance that is to his business. In Ontario, here in Canada, we have an opioid crisis right now, and we need to have alternative. Dr. Pearson is making sure that the doctors that are prescribing the heavy pain medication know that there is alternatives with using medical cannabis. Dr. Pearson in Canada is offering training sessions to the doctors in Canada so that they understand the education that supports the studies and the peer reviews that are currently coming out showing that medical cannabis can be used as an alternative to the heavy pain medications. And Dr. Knox, her family actually, a couple sisters, parents, they're all doctors in Portland, and they are advocating the importance of CBD as an anti-inflammatory. The power that's involved with bringing down your inflammation through CBD is a big one for them. And they too conduct a lot of online courses that show the importance of CBD in your day-to-day supplement. So what is CBD? In short, it's cannabinoid. It's derived from a cannabis sativa plant, which has two primary species, which is hemp and marijuana. Both of them have healing powers, but CBD does not exhibit the psychedelic effects. You do not get high. The importance of CBD goes to work with a system called the endocannabinoid system. The endocannabinoid system is also known as ECS. It's there as your control board for health. It is the boss of your organ system, your muscular system, your circulatory system, your pulmonary system, your skeletal system, your nervous system. They all are actually being controlled by the endocannabinoid system. This system was actually discovered 30 years ago, and it's not really being advocated well in the market when it came out. It's just now starting to get its just dessert. It's out there right now, letting everyone know that it is heavily reliant on the CBD oil to get the boost that you need to reach the systems. The story that I like to use is when you're stepping up. We've all gone on a boat. We've all stepped on a boat, and we've seen the boat all move over to the left side when everybody's piling in, and the captain's, all right, we need everybody to move over to the right. Let's everybody just move to the front. We just need to balance this out. That's what the endocannabinoid system does. It allows the systems that are in need of attention. The endocannabinoid boosts that information to, say, the nervous system. If the nervous system is falling short, then the endocannabinoid system realizes it as the control board of health and pushes the need that it has to that specific system. So the system itself is a bunch of receptors that are found primarily in the nervous system and interfaces with all other systems in the body. Every system, every organ, and almost every function has an endocannabinoid dependent. The ECS is the key player to all of this, and with your body being nourished with a CBD product, it is one of the most important steps that you can use to promote good health. Now, this is a chart of what this specifically looks like effectively. The endocannabinoid system relies on the CBD receptors to be healthy. It's kind of like coffee for your system. It just boosts the system where it's needed. It's been known to help those people that are perimenopausal, premenopausal. A lot of women are using CBD to help balance that system out. It promotes the homeostasis in your body to make sure that you are starting to balance out. If there's an inflammation, CBD will start bringing it down. The problem that we're finding in the market today, though, with all of the types of receptors that are in this specific chart, we're all biodiverse. We all have different systems. We act differently. So CBD needs to be worked with a practitioner that will help dose your specific body. So if you're needing, let's say, a teaspoon a day, that would be great for me. Maybe someone like you, Aaron, you only need a quarter teaspoon. It all works with working with a practitioner to make sure that we're able to give the boost that you're needing within the endocannabinoid system. Speaking of practitioners, that's one of the most important things that we want to make sure that everyone has access to when we're working with with Tantus Health. We want to make sure that the professionals are available. Our number one supporting system is the Hello ND team. They are a bunch of practitioners across North America that are setting up calls online so that if somebody wants to speak to a practitioner, but they don't want to head out to their own doctor, or they're not comfortable talking to their doctor about this, or they want to be able to have their own conversation online and in private. Hello MD is a fantastic partner that we brought on, where you can go onto our website, schedule an appointment, and give the practitioners there an opportunity to review your specific need. Other clinics that we're currently working with is wellness clinics like Vitality Wellness here in British Columbia, and the Apollo Clinic. They are in Ontario in Canada as well. And what these guys are certainly working with is making sure that people understand the benefits of this particular practice. We are seeing, in Harvard just actually released a study this week talking about the importance of cannabis in your system, in your endocannabinoid system, to boost cognitive awareness. That's a brand new study that's coming out that's going to get a lot of attention, as well as the report that just came about that talks about your respiratory system and how it can actually help protect your lungs during what we're experiencing right now with a lot of illness, COVID-19, flu season. It helps build up a little bit of a protection in with your respiratory system, with all of the anti-inflammatory properties that are available through cannabis. So with salt therapy, adding CBD to your system, it gives your lungs an amazing opportunity to protect you with what we're experiencing right now with our pandemic. So those are the conversations that the doctors are having with our patients, and they're giving them all the tools that they need to be supported into their daily practice. So what does that look like getting set up, and what to expect with working with these practitioners? I highly recommend working with someone that can give you the right dose, give you the right path, and that can only be done through medical practitioners. Our partners are there to set up appointments through HelloMD or through Vitality. They will give you an opportunity to walk through this, and that consultation with the doctors and practitioners will make sure that you have the right path. You will receive a medical cannabis prescription, and that prescription here in Canada is a unique one because Canada has now started to set up support either through your health benefits, your health insurance. If you're dealing with depression, the insurance practitioners will give you an opportunity to claim that through your health spend. And that's what we're setting up our team to do, is to educate everyone on how does your health benefits help purchase your health products. And we are educating everyone on how that process looks like, setting up on our website, being able to submit it to tax season. Tax season, you will actually receive income tax back for these health practice or these health product purchases. And of course, being able to have access to CBD and other medical products to help give the whole medical wellness, or the medical cannabis wellness, an entirety. The big term that everyone has been talking about lately is the entourage effect, and that's a complement of terpenes with CBD. And terpenes themselves, it helps with a lot of pain relief, and this speaks to what I was mentioning earlier about the opioid crisis. Terpenes are coming from the THC component. That's the psychedelic piece, but on a low dose with a CBD component, that is an entourage effect that allows your body to heal and without the strains of pharmaceutical drugs. And then being able to purchase your product online, we actually are able to ship products right to your home. So for those people that do not want to go out, or they do not want to go to a store, we will make sure that products are able to be shipped right to their home. And then that's just an example there where to get started. There's a lot of product that's out there, but one of the things that I like to recommend to folks is just know what the product is. Here in Canada, we make sure that everything is analyzed and the laboratories review, and it has to go through certain levels of review before it actually hits the shelf. There's a lot of products that we see out there that just don't go through some rigorous review. And that's where we like to make sure that our community is fully aware of who is providing our products? How are they making them in the market, and how are they shipping it to us through the regulatory system of Health Canada? That's a big one. Making sure that Health Canada has given a stamp of approval on that product allows us with confidence going to our patients and letting them know that it is a quality product that you're taking, and that it has not been added with any undesirable elements that you would not want to be taking on your day-to-day routine. So with that being said, that's a quick review of my company. That is CBD in a nutshell. I think the big message that I want to send to everyone is get to know what your endocannabinoid system is, because that is literally the boss of your system. And if you are not giving it its support, then your body will always be looking for it. It's going to be coming from somewhere, and that is the only product out there is CBD to help support that system.
Brilliant. Thanks, Ian. That's a really good introduction to CBD. It comes down to another small piece in a jigsaw puzzle, really, isn't it, of everybody's health. It takes a lot of these different complementary things to make us all as well as we can be. I do have a couple of little questions for you.
Absolutely.
Is it addictive?
No. The addiction quality, that's the one thing that they are focusing on, is making sure that the studies show that the products are not addictive. CBD is not a psychedelic drug. It's, if anything, it's an extraction used typically through MCT oil or coconut oil. There are delivery systems that are available. Some people want to use it through edibles. Some people want to use it through smoking or vaping. There are delivery mechanisms that will be offered through our product line that will allow people to take this on a daily basis and make sure that it is an added supplement to their daily routine.
Brilliant. And are these all taken as a kind of a syrup or a tablet, or how is it? I know you just mentioned that you can smoke it, but traditionally, what's the most common way of absorbing the CBDs?
I personally enjoy the oil, so you can use it through a dropper. I have a specific dose of 1 dropper a day, and I put it under my tongue. Interesting science there is with that delivery system, it's actually dissolved through your digestive tract. What science has now shown for a new delivery system is through the blood system. So it's nanoemulsification, which means it's delivered to the system a lot faster. So if you digest it, it can take hours. Taking it through nanoemulsification can take upwards to 10, 15 minutes. So the delivery system has enhanced in the last 24 months and allows people to use that much more efficiently when it comes to delivering the product themselves. So oil is one. I've seen a lot of people actually use through edibles. You can put it on your food if you want to deliver it through oil. So you want to sprinkle it on your salad or in your water, whatever the case may be. I've seen some products out there that in a tea format. So if you want to actually have a cup of tea, they do have the product available through tea bags and seep it through your water and have it that. There's clever ways of delivering the system. I've seen also some drinks coming out here in Canada as well. So there's lots of interesting, and that's always going to change. That's going to be developing into other products as time goes on.
Yeah. And when you start taking the CBD, how long does it take before you start to notice the effects of it?
So great question. Anywhere between 2 to 3 weeks is a nice buffer. And again, the dose is a big one, depending on your severity of need, depending on your body weight. And so working with a practitioner, they'll walk you through that. They'll make sure that you have a support system, knowing that you should start seeing some of the effects. Share a story with my mother. She is a 72-year-old woman who likes to go to bed at 1, 2 o'clock in the morning, just because her brain just won't let her sleep. Taking CBD within the first 2 weeks, she was then falling asleep at 11 p.m. So she's increased her sleep recovery of 2 to 3 hours, which is big for someone who is typically 4 hours a night in sleep. So getting 6 hours of sleep is huge. So she noticed that within 2 weeks.
Brilliant. Well, I found this really interesting, and I'm sure people probably have more questions for you. So how is it best to get in touch with you?
Our website is always available. That's tantushealthco.com. We can also send us an email at clientcare@tantushealthco.com. We've got a team available to review any questions. Our job is just to guide you through the maze of where do I go to get this. Here in Canada, you can buy it recreationally, but you can also get it through medical stores like my dispensary. That dispensary will allow you to take the benefits of working with the medical system to make sure that you are consulted properly and you're not left alone on your own device to get their product.
Brilliant, excellent. And I think this has been really, really valuable information. And again, just to reiterate, it's another one of those complementary treatments that you need to commit to. It's not a one-hit wonder. It's not an overnight fix. It's something that someone needs to, take seriously and continue doing for a decent amount of time to get the best results.
You couldn't said it better. This particular 2 years of adding supplements to my life just to prepare my body for what was coming at us with COVID-19. I wasn't taking vitamin C's on the regular. I wasn't taking vitamin D's on the regular. And working with Vitality Wellness and understanding the importance of adding those supplements to my life helped me feel a lot more confident stepping into the world, knowing that I've done the best I can. I've got my nutrition, I've got my exercise, I've got my supplements. Now I have to share the world that there are other supplements just than the regular band. We got to talk about medical cannabis. We got to talk about the importance of CBD because it is one of the key supplements to your endocannabinoid system. And that is the boss of all the systems. So we always like to keep the boss happy. So this is one way of doing it.
Yeah, I've definitely seen a lot more interest in CBD recently. It's definitely out there and being talked about a lot more. So I am interested to see what the future holds. But thank you very much for sharing the information with us today and gifting us your time.
Thank you so much for having me. And we're always available with questions. So feel free to reach out at any time.